Hello, everyone. Welcome back to Balance Beings Uncut, where we talk about health, wellness, and everything in between. Today, we have a very special guest speaker, which is Chloe Young. She's one of our amazing senior naturopaths within the Balance Beings team. We're so lucky to have her a part of our team. She's so smart and intelligent in so many areas, specifically eczema, allergies, food intolerances, mold, and lots more. But I wanted to let you guys know that obviously our podcast looks a little bit different today, and that's because Chloe Young doesn't live close to the clinic at all, and she actually never has. So, Chloe, did you want to take us through a bit more about how you work with not living nearby to us?
Yeah. Hello. So I am Chloe. I live up in the Whitsundays, so North Queensland. So because I am so far from the clinic, I am 100% work remotely. So I am completely online. So then when I am on the clinical calls, I just dial in using the little web link that is provided. Yeah.
Awesome. Take us through a bit more about what you into naturopathy and how do you like working online? How do you find
Yeah,
it?
so I graduated just over 2 years ago from Endeavour College of Natural Health, which is actually how I know Brooke. So we went to uni together. Initially I was Yeah, in Adelaide. Yeah. So yeah, initially I was studying the nutrition degree, and that's just from my history of having food allergies, childhood eczema, and hay fever. So I spent a lot of my childhood reading the backs of ingredients lists, and I was very aware of ingredients as well, and just noticing how many of our products were having more artificial sweeteners and preservatives being added. As I was very aware of food, like what was in our food. So that kind of triggered my interest in nutrition. I was actually on a plane between Greece and London, and I was sitting next to a doctor, and this doctor said to me, "You should follow your dreams." And then a year later, I actually enrolled into the nutrition degree because I didn't think that there was a nutrition degree that was kind of like that holistic nutrition. Like I didn't realize that that was existed. So then, yeah, I enrolled, did 2 years of that. Then I switched to naturopathy just from seeing all the naturopath students who were in the kitchen, always having those conversations about, yeah, being able to prescribe herbs. And that was very aligned with me because at that time, I actually really loved gardening. Um, so I had like a big veggie, like a big herb garden. So I was, yeah, very aligned with kind of like what my interests were. And it was definitely the best decision that I've, yeah, ever made was to
Still
study
remember,
naturopathy.
I still remember you in uni thinking about switching.
Yeah. Yeah.
That's
I had
about
those
time.
conversations in the kitchen so many times with people because it
Yeah.
was like it added a year to the degree. So I was like, do I want to add a year? And then it ended up actually being like an extra 3 years because of like maternity leave and COVID and stuff. Yeah. But that's okay. We got there.
Yeah, you got there in the end. How do you find doing naturopathy now? Like, are you glad that you did it?
Oh, absolutely. Yeah. Yeah. So I have a couple of friends who are nutritionists, and they're quite restricted in what they are able to prescribe. And I'm so grateful that I can kind of combine the nutrition side of things and with the herbs, because I think that herbs are extremely powerful, and we have amazing results with them.
Even if thinking about killing off bacteria alone, there's only so much you can do with nutrition in comparison to herbs. Antimicrobials that we typically use, like pomegranate, they're all herbals that you wouldn't be able to use if you were just a nutritionist, essentially.
Mm.
So it opens up
Yeah,
your
we got to use like liquid herbs and stuff. Yeah.
yeah,
Yeah.
opens up what you can use a lot more as well. So take us
Mm.
through more about your allergies and food intolerances now. Is there anything that you do to manage them as a naturopath, or anything that you do differently than you did as a child?
I found out that I was allergic to nuts on New Year's Eve when I was two. My mum had never actually exposed me to nuts. It wasn't well known back then to have that allergen exposure. And someone cracked open a Brazil nut and then touched my face, and then I went into anaphylaxis. And it was back then when nobody had any idea about nut allergies. Like I was the only person in my primary school who had any food allergies, the only person carrying an EpiPen back then. And my mum and my both of my parents were more of that traditional side of things. So when I had like the hay fever and the eczema, it was more of that kind of steroid topical application and all the creams from the GP and antihistamines. It was only as I got a little bit older where I started finding out about the how important gut health is in these types of things. So since I have known that, I do have a lot of like fermented foods, trying to really focus on gut health through like plenty of fiber, minimizing antibiotics as much as possible. And then when I had my daughter, I was very nervous that she was going to have food allergies. So I really had to kind of optimize my gut in order to optimize her gut. And then obviously once she did start solids, trying to optimize her gut as well, just through to help with preventing the onset of allergies. Yeah.
So take us through that gut health link a little bit more with allergies and food intolerances while we're on that.
Mhm. So things such as gut permeability can contribute to allergies, and the reason being that when that gut is quite permeable, the food proteins are able to pass through that gut lining into the bloodstream, where it then can contribute to things like the allergies, the reactions, the eczema, the asthma, the hay fever. And then there are some bacterial overgrowths that can also be a risk factor, then a contributing factor to things like eczema, asthma, hay fever. So things like Klebsiella, Citrobacter, those kind of histamine producing bacteria. There's also things like gut inflammation that can impact the nutrient absorption, which that nutritional deficiencies can then impact that immune system balance, can then exacerbate those types of things as well.
Yes, so would you say that allergies and food intolerances are mainly gut linked? Like, is that the first place that you would look at in regards to these?
Hmm. Yeah, definitely is. Yeah, there can be a gut link, but there can also be that immune system link as well. So things like low vitamin D, low zinc can also disrupt that immune system balance. So it's kind of about a bit of a deep dive into people's health, looking at like blood tests, looking at gut testing, analysis tests, whatever you need to do to truly understand what's going on, because it's not always just the gut. And you can do all these wonderful things with the gut. If you are missing, say, like a zinc deficiency, then you're not going to get those long lasting results.
Yes, 100%. Take us through the amazing results that you've had in the clinic or something that you remember and what you love treating in the clinic.
My favorite thing to treat is eczema. I just love it's literally life changing for the mom, it's for the parents, for the child. One of the cases that stands out the most for me was a little boy. I'm pretty sure he was 6 months old when we started treatment, and he had pretty severe eczema, so it was like all over his body. We ran gut testing. There was pretty significant bacterial overgrowth of Citrobacter. It was in like hundreds. Um, we started work and at very high levels of gut inflammation, gut permeability as well. So we started modulating those types of things using herbs and supplements. We then ran hair mineral analysis testing and found that there were quite a lot of nutritional deficiencies. And by addressing those things, it did take a bit of time to kind of calm the eczema down. I'm kind of about that 3 month mark where he was like about 80% better. But now he is currently 100% eczema free, hasn't had any eczema flare ups for so many months now. He also had a bit of like kind of potential like dairy intolerance as well at the time. So we have been working on reintroducing dairy as well, just to help with minimize, because if a child doesn't have that dairy exposure, because there's a dairy intolerance, it can increase the likelihood of then developing a dairy allergy because the body isn't getting that exposure to those allergens. So it's kind of like that fine balance of getting that gut in a really good place to be able to tolerate those foods.
Yes, definitely. Take us through some of the products that you used in that treatment.
We used gut care for kids, glutamine, zinc. We also use a lot of like liquid herbs, so things like nettle, basil skullcap for reducing the histamine load, and to support that skin cell turnover and regeneration. Pomegranate, calendula. What else did we use? Thyme as well was a good one.
Yes, thyme's really good. I find that
Yeah.
thyme works amazing for different types of bacterial overgrowth in the stomach. Pseudomonas is
Mhm.
a big one. I find that thyme really helps to kill off as well. When used in combination with Pordaco, I find it works really well for Pseudomonas. Um, so yeah, the gut bacteria has a big link with allergies. What would you say is the most common bacterial overgrowth that you would find that contribute and cause or worsen allergies?
So it's more like Klebsiella, Citrobacter, Pseudomonas, I think also has a bit of a link with allergies as well. Um, yeah, and any bacteria that kind of just can disrupt that gut lining integrity.
Yeah, I found Streptococcus and Staphylococcus has caused some allergies too. When I've cleared them out, I've had some amazing results with clients who have went back to allergists and they're not allergic anymore as well, which is absolutely amazing.
Mm.
But lots of gut lining work too. in combination. So it's definitely that like gut lining link with allergies for sure.
Yeah.
Um, so besides that, take me through a bit more about with the allergies and what you do. Like, how long would you do treatment for, and how's that determined?
The length of treatment is honestly dependent upon the results. So how significant that gut damage is, how big the bacterial overgrowths are, how many of bacterial overgrowths there are as well. Also, how long it takes for the parents to get a blood test. Sometimes that can be a bit tricky, so that we can double check on things like vitamin D and iron levels. We can combine it with hair mineral analysis testing to check other nutrients such as zinc. But yeah, some of those nutrients like B12 and vitamin D, and they do actually require that blood test to truly understand if there are any nutritional deficiencies and how severe they are.
Yeah, definitely. And also finding that sometimes I'll see clients that have got really bad eczema and high copper levels are actually
Mm.
impacting the eczema, and that's because zinc can't be utilized because they have the same sites of absorption. Um, Zinc can't be utilized properly until that copper clears out. So a lot of times treatment can look like copper clearing, or it could be increasing zinc levels, or it can be addressing vitamin D, or it can be supporting gut lining or killing off bacteria. So the type of treatment we do for allergies and eczema and hay fever is really dependent on what we actually find in testing, which is why we do testing. What about for the people that really want to prevent their kids getting allergies and food intolerances? What would you say you would do pregnancy wise for a mum that wants to prevent their risk for their child?
I would recommend doing gut testing, hair mineral testing in that preconception stage of side of things. Just to make sure there are no large bacterial overgrowths. Doing that at least kind of 6 months prior to conceiving, so that then when you doing that work and then about 3 months prior to conceiving, you're just optimizing that nutrient status. Then during pregnancy, continue working on optimizing the gut health using prebiotics, probiotics, lots of like fermented foods, dietary fibers, and then trying to, where possible, avoid antibiotics. Like antibiotics definitely have a place, but it's just trying to minimize them, and where possible, use alternative methods. And then, as you progress, once the baby has been born, where if possible, have a vaginal birth, breastfeed as well. They have been found to have preventative effects. Keeping mum's nutrient status up, making sure that there are adequate levels of immune modulating nutrients such as zinc and vitamin D, iron as well. And then when baby does start solids, making sure that the allergenic foods are introduced when the child is well. Lots of like bone broths and bones, meat stocks to really support the baby's gut lining integrity.
Yes, 100.
Another one as well is making sure that any creams that are applied to a baby's skin, making sure that they don't contain any food containing they don't contain foods, and that's because when a child has exposure through to foods through the skin, prior to it going in the mouth first, it can increase the likelihood of allergies developing. So that does include things like coconut oil, any like food-based ingredients ideally goes through the mouth first.
That's very interesting. So awesome. Going back to the preconception preparation. So the reason we say that mum's so important is because that bacteria has been found to transfer through the placenta and through breastfeeding as well. So what mum has is going to increase the risk or decrease the risk of allergies and food intolerances in bubs. And the reason, Chloe, was, I'm assuming the reason you were talking a bit more about why we do it 6 months before, but then nothing 3 months before we fall pregnant, is because we want to prioritize the egg quality. When we're doing
Mhm.
antimicrobials or toxin elimination, a lot of times what happens is that actually impacts the DNA fragmentation and DNA health that the egg quality is being like made of essentially in that time. So we don't want to impact that quality of that egg by doing toxin elimination or antimicrobials during that time where we're prepping the egg, essentially. Our body's prepping the egg.
Yeah.
Is that what you were going to say? Is that the
Yeah.
reason?
Yeah.
Yeah.
There's
Um,
just so many things that you could say that you're like, you don't know which direction to take it in.
yeah.
Yeah.
And the other thing is, yeah, we transfer bacteria from about second trimester onwards from our bubs. And so we really want to prioritize optimizing our gut health and doing all those things. And then the first foods that bubs have should be really gut repairing,
Mm.
prioritizing that, and obviously prioritizing iron and omega-3s because typically from that 6 month mark, we're not getting enough from the breast milk, which is why we have solids.
Hmm. Yeah. And then optimizing mum's oral microbiome as well. There's some research to support that that can impact baby's gut microbiome.
Yes, yes, 100%. So our oral microbiome impacts preterm birth risk, miscarriage risk, and bub's microbiome too. So making sure in pregnancy you're doing a dental checkup. And
Mhm.
then obviously making sure that you're prioritizing your oral hygiene and your oral health too. What would you say are the worst foods that impact gut lining the most for an infant if they were introduced early?
Things like dairy, like gluten, so things like wheat bix, like the poor quality gluten, like artificial colorings, artificial sweeteners. I don't know
Rice
what
cereal.
else. What was that?
Said rice cereal as the first food. Can
Oh yeah, rice cereal. Yeah. Which is actually GPs are the ones who usually do recommend that rice cereal being introduced to thicken formulas for like things like colic.
yeah. Definitely, and
Mm.
that can cause some gut irritation and gut damage to infant stomach lining, which then can impact allergy risk. So we really want to
Mm.
make sure we're using those good quality foods and also um, working on like bone broths and good quality probiotics. But if you're finding that if your child's having fermented foods or broths that they notice that they get a rash or eczema, what would you tell that patient to do, Chloe?
If Yeah, there was a lot of bone broths going in. Unfortunately, they are very high in histamine, and histamine can then exacerbate things like eczema, itchiness, irritation, impact sleep quality as well. So for some children, there can be, say, like large, like a big bacterial overgrowth that's increasing that histamine level in the body. There can also be genetic SNPs that can impact the child's ability to be able to process and break down histamine. So sometimes when you do put bone broths in, it is too much for the child's body to handle. So then you would look at trialing, stopping those foods to see if that helps with that presentation.
Yeah, 100%. And take me through a bit more about environmental allergies and how like you can help manage this and what you look at doing in clinic for this.
So environmental allergies are a big one and they can be quite tricky, particularly the dust mite allergies, which seems to be very, very common in clinic at the moment. So if there is a dust mite allergy, you can get that confirmed via skin prick testing or via a blood like IgE blood test. If a dust mite allergy is present, then it is about really cleaning up that environment to minimize that exposure to dust mites. So taking like stuffed toys out of the bedroom, having a hard bed frame, like a wooden bed frame instead of like a soft bed frame. Lots of cleaning, removing the carpets from the bedroom if you can. If it's not possible, then using like a vacuum with a HEPA filter on it just to really minimize the exposure to those dust mites, having dust mite proof bedding in there as well, and running an air filter can also be quite beneficial as well.
Definitely. Would you say is the best type of flooring in homes? As a
Best type of flooring, ideally like the wooden flooring, because then it's not going to hold on to those dust mites and you're able to kind of sweep it and mop it and clear out all the dust mites as best as you can.
100%, and it's not impacting toxin levels either because they're well, like wood is not toxic, essentially. Like other vinyl floorings and whatnot, they come with lots of toxin risks as well, which link to other types of health conditions for a lot of people too. Besides that, more environmental, is there anything that you look internally to do to help with reducing environmental allergens like vitamin D or anything that you found that's helped in the clinic?
I find that vitamin C is really good for reducing the histamine levels. Then, yeah, optimizing zinc levels as well. Vitamin D, iron as well can also be really beneficial. Using the quercetin-rich foods as well. So quercetin naturally has those antihistamine effects. So introducing as many of those foods as possible. So having berries for breakfast can be quite beneficial.
Yeah, 100%. And factors that impact eczema that you find are often missed. we've done a podcast on eczema, the most common causes, but obviously you treat eczema a
Mhm.
lot. I would say that you treat eczema the most out of our clinic, even if you added me and another
Or
person up.
yesterday.
Yeah. If you added me and another person up, you would see it more than two of us combined. So I know that you know all the triggers of eczema, but what are some things that you feel like a lot of naturopaths commonly miss with eczema or just aren't as common, but you find are typical causes of eczema?
Um, I find that a lot of naturopaths, they like a lot of people come over from other naturopaths or other people they've done testing with, and they've done the gut testing, but then they haven't looked outside of that gut testing. So they haven't looked into like blood tests to see if there are any nutritional deficiencies. They also a lot of time haven't looked at a hair mineral analysis test to ensure that those mineral ratios are optimal. And another factor that I have been finding recently is contributing to that kind of chronic eczema state is mold exposure. So people like living in a home that is affected by mold and not knowing that it's there, and yeah, it's just impacting that immune system regulation. It's kind of going a bit around and around in a circle because the mold exposure is contributing to that gut permeability, and then it's then driving that eczema presentation.
Which is so interesting. We'll dive a bit more about mold in our next session with Chloe. But
Mm.
as a little sneak peek, what would you see on a microbiome mapping with a kid that had eczema if it was mold?
Some things that I look out for are things like high beta glucuronidase, low pancreatic elastase, high steatocrits, and candida overgrowths in the gut as well, and low oxalobacter formigens, which is a beneficial gut bacteria.
Yes. Speaking of oxalobacter and oxalates, do you find a lot of kids with eczema have oxalate issues as well?
Yes, I've had quite a few recently, actually. So it's like a lot of people they know about taking the high histamine foods. I feel like there's a lot of information on social media about taking out the high histamine foods at the moment. So usually a lot of parents have actually tried that prior to coming into clinic. But one oxalates is one of those ones that a lot of people haven't tried. And yeah, when you do have high levels of circulating oxalates because you're unable to break them down properly, it can really exacerbate that skin presentation. So it does drive that kind of like low grade systemic inflammation. They do bind to minerals and impact mineral absorption as well, which will then further exacerbate the eczema presentation and prevent the eczema from completely healing.
That's so interesting. Can you take
Mm.
everyone through oxalate dumping a little bit so everyone doesn't go and take out oxalates from their diet? And
Yeah, definitely do remove the oxalates under the care of a health practitioner. Because if you take the oxalates out too quickly, you can get what's called oxalate dumping, and that is where those little oxalate crystals they can literally actually start coming out through the skin, which can be really painful. They can also get really painful urination, and just like lots of anxiety, a lot of pain as well. So ideally, you'd only be wanted to reduce the oxalate intake by about 5 to 10% per week. So you don't take all the high oxalate foods out all at once because that's when you can trigger that oxalate dumping. It's a bit of a balancing act.
yeah. And with the oxalobacter levels, that is what breaks down the oxalate that we see in a gut microbiome report. What would you say causes that level? Have you found any links there of why that
As
oxalate?
in at the low levels.
Yeah.
Yeah, so mold exposure is a big one that can wipe out the oxalobacter formigens, but it can also be easily wiped out by antibiotics as well. So I've had a few children who've only had like 1 or 2 rounds of antibiotics, and there's not the oxalobacter formigens isn't present at all.
Yeah. I have found that as well as one of the earliest factors that I see wiped out too. Is there anything you found to help increase oxalobacter levels, or is it more about like removal of oxalates in the body?
Sometimes, yeah, taking the oxalates, reducing that oxalate load for a little while for that kind of 6 to 8 week mark, it will take the pressure off of the kidneys and the body systems while you are supporting that proliferation of that beneficial gut bacteria. So the Oxalobacter formigens is a oxalate degenerating bacteria, but that's not the only oxalate degenerating bacteria. So there are others there. So some people do say that once a strain of bacteria has been completely wiped out, that it's not actually always possible to get that bacteria back into the gut. But then the other bacteria which are present will then proliferate to be able to compensate for that. So a child may not be able to go back to eating unlimited amounts of oxalates. They may always have that kind of threshold that they can go up to that point. But it's always, yeah, going to be about optimizing that gut health to see at how far we can take that oxalate load.
And with in going back to eczema and allergies and intolerances, and in regards to hair mineral testing, we know that
Mm.
copper can cause a big factor with impacting this, but mainly because it impacts the zinc levels. Have you
Yeah.
found anything else that you found mainly in that hair mineral analysis, like lead or aluminium or even selenium, that impacts eczema, allergies, or food intolerances?
Yeah, so there is a link between selenium and food allergies, because selenium does have that immune regulating effect. So it's one of those nutrients that you do want to try to optimize, and it's so common to find the low selenium in children. Like I think I've only seen like 2 or 3 children in 2 years where the selenium levels have actually been where they should be. They're always so low. And it's because our food is the foods that are meant to have that really good selenium content. Our soils are just so deficient that they just don't have that selenium there. Um, yeah, so yeah, selenium definitely does it, but also yeah, those nutrition heavy metal excess can also impact the absorption and utilization of things like zinc as well. So things like aluminium, mercury, and also the heavy metals can contribute to that kind of like again that low grade systemic inflammation and disrupt that immune system balance as well, which can then drive the eczema, the allergies, the hay fever, the asthma as well.
Yes, and it's like this synergistic balance. Like, yeah, we want to look at the gut microbiome first because they're more likely to trigger allergies and eczema intolerances. But we've also got to remember that like that leaky gut might be leaky and not being able to seal and heal and repair properly because we're low in zinc. But then we go and do a hair test, and the reason we're low in zinc is because there's other heavy metals or copper that are impacting the zinc to be used. So then we kind of need to clear out that and help the zinc levels to then impact the leaky gut and repair it properly. So it can be like
Yeah.
this aggressive cycle of like, when do we test? Because we obviously love to see everything, but at the end of the day, that's not always realistic either.
Yeah, no, it's not. Yeah.
Definitely. Do you find any genes or DNA fragments that you find like abnormalities in DNA testing that cause allergies or eczema or even food intolerances that you've seen any links with?
So there are genetic SNPs that can impact like a person's ability to be able to process histamine. So things like the DAO and the H and MT genes, MTHFR as well can impact that MTRR pathways as well. Can really impact the body's ability to be able to break down histamine.
Yeah. So when you see these genes, what do you do for treatment if it's something the genes aren't something we can change?
And then looking at nutrients that optimize that gene function. So for example, B6 is really good for helping the DAO enzyme. So it's about kind of looking at that genetic picture, working out based and comparing that to how the person's symptom picture, because you can be a carrier of these genes, and it doesn't necessarily mean that these genes are active. So it's about kind of working out which one is contributing to that person's presentation, and then working out which nutrient is going to be the best, or even herb is going to be the best one to support that pathway. Yeah.
Definitely. So take us through for the naturopaths that are watching and are wanting to look at more testing based. At what point do you think, okay, I need to do another test now that I've done this test because I feel like I'm missing something? Like at what appointment or what point do you feel like that? It's something that a lot
Um,
of people ask us, and it's hard to, I guess.
Yeah. A lot of time I do start with gut testing because everything kind of starts in the gut. So if you do have big bacterial overgrowth, there's kind of no point starting that nutritional repletion and working on, optimizing the hair mineral test until you've got that gut lining in a really good place. Honestly, it depends upon the person's symptom picture as well. So if I find that they're improving, but then there is that kind of plateau, that's when I'm like, okay, there's something more to this picture. And then that's when I would look at, say, testing genetics, or if I would then look at testing hair mineral. Also making when you are dealing with young children, a lot of children don't have enough hair to be able to run that hair mineral analysis test. So you kind of got to wait for them to have enough hair for that test to be done as well. And also basing it upon, as you do gather more information about like the family history and like well, from consult to consult, you do gain more information, and that kind of gives you more guidance towards like, is this mold? Is this genetic? Is this nutritional deficiency? But I really love to combine a hair mineral analysis test, a gut test, and a blood test as often as possible for children. And genetic testing is kind of like the cherry on the top to be able to truly optimize the child's health.
Yeah, to be able to really treat and not have to question yourself at all.
But
All
also, I just find the genetic stuff is just so amazing and so effective as well. Like some people who've had like methylation like symptoms, and we've done like all the B12, we've done the folate, we've done all those types of things, and we're not getting the response that we would expect. And then we go in with we go and do the genetic test, and the genetics show that they have a very high demand for choline, and then you give them the choline, and it's like life changing.
yeah,
Yes, it's like it's so cool to kind of work out exactly what that pathway is needing, because then it will then cut down the number of other nutrients and herbs that are being given, because you're just giving what the body is kind of needing.
yeah. It cuts through wondering and questioning as well. A lot of the time, you can actually just see, okay, well, this is why we haven't got X, Y, Z. And so a friend always says, oh, like, testing's quite expensive. My patients can't afford testing. We like to reframe it as we're saving money by testing because we're not wasting money on products we don't know that are or aren't helping by guessing. So that's our
Mm.
biggest thing. We'd rather you spend money on testing than on
Mm.
treatment with us so that we can actually know what's wrong. Take me through a bit more about what you would do with clients that have hay fever that happens monthly. What would you look into, and do you know why this happens?
Mm. So some people do find that when they are coming up to the cycle, that they get things such as migraines, headaches, runny nose, nasal congestion, hay fever, those types of histamine like symptoms. And this is because of the estrogen fluctuations that occur towards the menstrual cycle. So as the estrogen increases, this increases the histamine levels, and then the higher histamine levels then drive that higher estrogen level. So it's kind of like that vicious cycle. Um, so what we would look at doing is trying to interrupt that cycle. So by using things such as like herbs such as chaste tree to regulate those estrogen levels, then supporting the detoxification pathways to support the clearance of the excess estrogen, but also that excess histamine as well. Then we can also look at using nutrients such as the vitamin C, zinc, quercetin, all those kind of like classic antihistamine nutrients, again, to bring that histamine load down, which will then help reduce the stimulation of the excess estrogen.
Amazing, awesome. Yes, histamine we see a lot come into the clinic, and a lot of times
Yeah.
migraine, headaches. People think a lot
Mm.
of times it's PMS, which again,
Mm.
estrogen levels will do that, but a lot of times it's because the actual histamine that's happening through the month.
Yeah, yeah, and also painful periods can also be due to that high histamine levels as well.
And a lot of times
Yeah,
estrogen's lack of detoxification, and so sometimes that can be again a gene snip like MTHFR gene impacting clearance and elimination of hormones, or even COMP gene as well.
yeah,
So
yeah.
in
I
genes.
found DAO. Seems to be the one that I find has that biggest impact. So the people who are DAOGG, that SNP, where it's like that they're the homozygous, they're a carrier of the two copies. They seem to be the people who like really kind of struggle with like PMS and painful periods, heavy periods, migraines, the hay fever, the asthma as well, like really big histamine picture.
Wow. Yeah,
Mm.
see that a lot. It's crazy how much genes really impact histamine and whatnot as well.
Mm.
But yeah, so yeah, detoxification channels like we use a lot of St. Mary's thistle or
Yeah.
calcium glucarate as well for estrogen
Mm.
elimination. So that really, really helps to then address that histamine picture because histamine builds less with estrogen if it's a monthly relation there as well. So we definitely find that helps a lot. And again, with histamine, making sure those pathways of detoxification are working properly impact histamine levels, I find as well.
Yeah,
So, yeah.
absolutely.
Yeah. Well, awesome. Thank you so much for coming onto the podcast with us today.
Well, great. Good to see
I
you.
Good to see you too. A lot of people always ask how to get treated by Chloe. So Chloe doesn't take on any new patients at all anymore, like me. So as a senior naturopath, what we do is we essentially train up all the other naturopaths in the team. So we train them with our knowledge. So seeing another naturopath essentially means we're going to get treated by Chloe because she's going to be checking plans and she mentors the other girls just like I do as well. So everyone can have the same training and result outcomes regardless of who they see. So that's where a lot of Chloe's time goes as well through mentoring and training, which the girls absolutely love because she has so much clinical knowledge, and she's so great at her job. So we're very lucky to have her part of the team. And thanks so much for joining us today.
No worries.
Until next time, may your days be healthy and your weeks be balanced.